Another day almost done. It's 5 o'clock and I'm just absolutely exhausted. Finished up my FOSCI in the morning, pre-lab, then presentation. What is up and good morning, YouTube. For those of you guys that are new here, my name is Jason, first year medical student in Washington, DC. And today I want to take you through the busiest day that I'm gonna have of medical school. So we're starting the day off with our FOSCI. So we're going in and seeing standardized patients, taking full history, full physical, and writing up a note. And then right after that, I have to do my anatomy lab, covering liver mainly, and then a quiz on that. And then I have a presentation, and then I have to study for my exam coming up. So today is actually the busiest day of medical school. So in order to make sure that I make it through alive, I'm gonna need you guys to absolutely smash that like button, like smash the like button. I need all this help that I can get from you guys. So about to get the day started. Already had my greens, I've had my water, I had my coffee, I brushed my teeth. Today, we're off to a good start, busy start, and just kind of ready to go. I'm gonna get the day started, get my mind right with some Anki cards, and then we're off to school to go and see standardized patients. So let's just get right into it. All right, so I gotta get 200 or so Anki cards done for the day. Now I need to get ready to go to our FOSCI session. But I wanted to show you guys one thing. So what I do whenever I have some sort of like important meeting, or I have to go into the hospital early, or in this case FOSCI, I like to prepare all my clothes out the night before. So that way in the morning, I kind of do what I need to do. Everything's already set. So I do everything. I got socks, underwear, pants, belt, and then shirt hanging up over here. So I'm just ready for the day. Now about to hop in the shower, then get dressed, and we are off to class. All right, ready to go. Decided to opt with the polo instead. And yeah, let's go see our patients. See how can I practice being a future doctor. All right, let's go. Okay, so I think today we have patients coming in, they've taken toxic levels of a drug. We have to figure out what the drug is based on the color, the description, the numbers on it, try to figure out all that out, and then see how we can cure them. So let's go see these patients. Just finished up seeing standardized patients, got some free food from the hospital cafeteria. Now we're heading home and we'll chat. All right, just made it home. Gonna devour this food. I wanna talk really quickly about the case that I saw. So it was one case that was diverticulitis, another case appendicitis, but I think the more interesting part was we had a librarian kind of discussion of what happens when a patient comes in and they tell you that they have swallowed all these little pills but don't know what they are. How can you figure out what it is and what can you do about it? So that was actually a super interesting little discussion and topic that we had. Now going to just eat, and then we're off to anatomy lab. All right, all dressed in the official med student uniform. Just got some scrubs on. Gonna throw on my obvious Patagonia jacket just so I can properly fit into the med school lifestyle and attire. But I am just finishing up a cup of coffee before we have to run over to class. And we start our anatomy lab, and then right after that, run over and do a presentation. So just gonna take you guys along with the busiest day of med school that I've had so far. So let's get right into it.
Keep dancing with the devil,
What is up? Just finished up the last anatomy lab of the semester. Got to keep it somewhat quiet because people are studying out here in the library. So have about, how much time do I have? Like 30 minutes, and then I have a presentation on acetaminophen toxicity. So I'm gonna quickly run through it, make sure I'm ready for all the high yield points, and then we're just gonna get ready. So yeah, just gonna flip through the stuff really quickly and then just relax before last presentation of the semester. All right, friends, presentation ready to go. Added one last little final tweak to add some fun animations. So let's go get this presentation over with because I am getting tired. This has been by far the busiest day I've had in medical school. Friends, another day almost done. It's 5 o'clock and I'm just absolutely exhausted. Finished up my FOSCI in the morning, pre-lab, then presentation. I was going to try to record the presentation, didn't get a chance to do it. I was going to try to record my presentation, but I didn't get a chance to do so. But I actually had my presentation from 2-3 weeks ago recorded, so I'll just put that here, show you guys how I present. But yeah, just need to get out of these gross I need to get out of these gross formaldehyde smelling clothes. These scrubs are gross. So just quick rinse and then we're back to studying. Gonna do an exam review and just keep going about the last push of this block. I am just counting down the days for the semester to be over with. So let's just relax for now. Probably grab some dinner and chill before we do exam stuff. All right, so I'm cooking up dinner right now. Well, not cooking it up, I've already cooked it up, just meal prepped. Here I have dinner, the typical ground turkey. Now I've been steaming my broccoli instead of cooking it, and sweet potato. But as you guys can see here, decided to switch it up. So now I've been doing something different. I've been frying up an egg to throw on top, and then with that, I'll add on some sriracha, and I swear, oh, perfection. You let the yolk run. Oh, all right, I gotta show you guys how this actually looks. All right, so you just take the egg and throw it right on top. Oh, and now, all right, so now just going to mix this all up, throw in the sriracha like I said, but this meal is gonna be amazing. I'm going to enjoy this, relax, and then I'll catch you guys later for some studying. All right, devoured dinner, perfect, and how I am exhausted. I just wanna go to bed, but med school calls and I gotta go do some more studying, so trying to finish up the Anki cards for the day, go through reviews, and then just kind of prepare for my final exam week. So the time you guys are seeing this will be Sunday, and so the next whole week will just be my finals exam. So kind of talk through that really quick. Let's go to the computer and I'll show you what I have in store for finals week in med school. Finals week, it actually looks horrendous, but it's not terrible. So Monday, I have my last GI or liver exam. This exam is me focusing on liver. And then Tuesday, Wednesday, and Thursday is designated time for my PBE. And the PBEs are practice physical exam, where we pretty much have to go see a patient, take a full history, full physical, and then write up a full office note or NBA Meet style note. And then Friday morning, we have our public health final in the morning. So the first part is gonna be a individual exam, and then we come together for a class or small group case discussion. And then we ended the Friday afternoon with our NBME exam, which is a practice step 1 exam. So that is finals week. So this next week is going to be just a long week. So within the PBE, I don't have Tuesday, Wednesday, and Thursday to take this exam. I'll be designated, I think it's like a 3-hour, 4-hour time slot within that period. So it could be anytime between 7 a.m. and 9 p.m. from Tuesday to Thursday. So not looking forward to that. We should be getting our schedules out soon as far as, you know, what I actually have to do. But yeah, let's get to work. Let's finish up some studying, get some reviews in, and then probably call it an early night because this has been by far the longest day of medical school. All right, so I have my whole setup here. Just gonna show you guys how I pretty much take or go through my exam review. So on this screen here, I have all of my lectures that I can kind of scroll through. So I have about 3 weeks worth of material for this. On this side, I have my notes when I was first taking the exam the first time. So that way I can kind of see what was I thinking here and what do I need to kind of work on. And then I can also add in notes. Perks of having notability. These are all my handwritten notes, all right there. And then I can type stuff in here as well and just move where I want the text box to kind of go. So that's that. And then here on the exam itself, we're going to go through this exam once more, just start answering questions and just kind of go through it all to prepare for all this stuff. So like I said, exam from the time that this video is up is the next day. So gotta really put in the work now, make sure that I am ready for exam time. So let's just start exam review, as miserable as it sounds right now. Just finishing up, doing this whole exam review, and I'm going to take a quick break right now because our 4th years at GW are currently hosting a panel about where they match into internal medicine and their path to kind of get there. So I'm going to have that in the background, do a little bit of note taking, have a little bit of a snack, and then just keep the studying going. So let's go see what the 4th years have to say about their whole journey. To all the 4th years for coming back, giving their talk, and kind of helping inspire all of us M1s, M2s ready to start on our journey, especially going into clinicals, especially kind of preparing and thinking what are our next steps. It's kind of just giving me that little extra push, keep going, keep doing all the little things, making sure that I'm on the right path. But again, just going through the rest of this exam, it's been a very long day. So I'm going to finish this up, and then yeah, I just need to finish this up. Oh, all right. I am just absolutely wiped. This whole day has been so long. Started off in the morning, going over our FOSCE, seeing standardized patients, and figuring out what is their diagnosis, specific, how do we determine what pills did they take. Nuts. Then I had a quick little break off to anatomy lab, went through the liver, again, another quiz, and then finished it off with a presentation. So today has just been brutally long. Ended it off with exam reviews, and guys, it's not even 9 o'clock and I'm ready for bed. But I just want to thank you all for making it to the end of the video. It truly means so much to me, all the love and support I've been getting recently. Let's continue to make this grow because we are on the road to 1,000 subscribers. Can't do it without your help. But I'll catch you guys in the next one as we embark on the journey of MD in the making. Peace.